Hi, everybody. My name is Ben Loomer. I'm on the Provincial Resource Team, and I'm very happy to see you for a webinar, which is called Developing School Partnerships for Health and Wellbeing. This is a topic which is very important and is seen in many different CLC action plans. And we wanted to make sure that we can continue a conversation around what CLCs are doing and how to develop strong partnerships. So talking about health and well-being needs in the school, the question is, who are we talking about? So this concept has changed over time and expanded, but specifically in this context, we're talking about the health and well-being of our students, the health and well-being of school staff, especially in the context of COVID, which has created a lot of stress for staff having to work under, I would say, extraordinary conditions with masks and a lot of the stresses around, up until recently, a whole unvaccinated population of children under the age of 12, for example, and as well families. So the health and well-being of families, which of course surround students and contribute to their health and well-being. What are we talking about? We're talking about mental wellness. We're talking about physical wellness, which includes things like exercise and nutrition, but also specifically thinking about access to services in English, which is really important for the families and the English-speaking community in which we're all working. And I wanted to also speak about the context of, it's my understanding that this year, all schools and school boards will be renewing their school success plan. And I really wanted to underline this discussion as an opportunity to help develop those partnerships which will contribute to the school success plan. This notion that schools don't need to do it all on their own. They can start considering who are the different partners that can help achieve many of their goals and outcomes that can all be done together. So very quickly, I want to just give you a quick highlight of 3 different tools that you can find on the Learn website. I want to show these are also tools that I included in the email that I sent on Friday. Very quickly, there's the School Wellbeing Quick Assessment Tool. So this was developed a number of years ago in collaboration with the CHSSN. I wanted to highlight this as a type of tool that will let you know what your CLC school is doing well, and then what areas need reinforcement. And again, we're going to dig deeper into this tool a bit later, but I really want to underline over the next few tools the sense that in order to develop partnerships, you need to know what your needs are. This is really essential, and this is an important tool to help you achieve that. There's also a tool on the Learn website, which is called, it's a risk and protective factors for enhancing the well-being of English-speaking youth. This is something that Russ shared with me a number of years ago, and I really love it in terms of thinking about risk and protective factors as being 2 sides of the same coin. So you can ask the question, where are students in my school or community at risk? So what are the different risk factors? And then where are students protected? So it's really a wonderful way to think about, is there a risk factor in our school, or have we done a really good job with protective factors to protect young people against certain risks? So this is a great tool, again, that you might want to use with your school staff or partners to identify different strategies to support health partnerships. And the last tool I wanted to share with you just very briefly before we loop back to it near the end is something called the Action Framework. So a number of years ago as well, we created a document which outlines a framework and best practices for developing strategies, goals, and programs that work really well with the linguistic minority community. And there's different outcomes, the different building blocks, what has been learned using different approaches, and then what it means to be strategic. So as I said before, we'll go deeper into this, but this is something you might want to read or look at and consider as CLC schools develop partnerships. What is important about a framework is that it's something that you can kind of hang a coat on, hang different strategies on, especially when it's been done in terms of best practices or what works. It really, makes it stronger when it's based upon a framework. So with that, I'd like to pass things over to Russ and Amy, who can talk a little bit about what the work of the CHSSN is and the potential for partnerships there. So Russ and Amy, I pass it over to you.
Thanks, Ben. I'll start off and then I'll pass it over to Amy. So the CHSSN and Learn
The CLC initiative has had a wonderful collaboration history. Like it really dates back, well, since the beginnings of the CLC initiative, we were right there at the beginning. So the CDAs, you guys that are doing your work in the schools and communities, there was a natural collaboration with what we call the NPI. So it's called the Networking and Partnership Initiative. So these are English-speaking regional organizations hopefully in your region, that they sponsor a program that comes down through Health Canada to us. And their role in health is in health and social services. And Ben talked about improving access to health and social services in the English language. So I'm going to show you a little bit of that. But I just want so anyways, but I'll just do a little quickly recap. And some of the things too that Ben showed you just to start off. This was way back when a lady by the name of Paul Langevin started the CLC, was involved at the very beginning. And I was just coming into the CHSN way back there from Alberta Health and Wellness, and I was involved in comprehensive school health. So I'm a huge fan of school health, you guys, and I absolutely love it. And so my role at the CHSN, I've been there for quite a while now. I do everything I can to continue working in the area and helping support you guys in your network. I'm a huge fan of the CLC initiative, by the way. So, all right, let's just get into it. So maybe next slide. Okay, so yeah, there's a picture of our website. So you see the NPI. So it's all these acronyms, right? I still have to get used to you guys being called the CDAs. I'm still getting used to that one. But you might hear this word NPI. If not, there's people that work in these regional associations that have different titles. And I'll just show you a little bit of where they're at. So maybe we'll just move on to the next slide. So you can't really see this, but if you went on to the CHSN website and you went under the Networking and Partnership Initiative, you'll see this map that you can blow up. All right, so these are the names of the organizations that sponsor this program. What's interesting in the last few years, there's been some new organizations that have cropped up, but also there's satellite offices. So some of these organizations that you may say, oh, I think I know someone in my region, but they're so far away. Well, maybe their office is a bit closer now than you thought. So if you can see, you'll be able to see there. Go ahead and use this too. You can see it gives you the total population of English speakers, the number in your regions, and also the percentages. It doesn't go by school board. It goes by CIS geography. So the RTS, we call it the Regional Territoire des Services. So anyways, those are the names of what we call the NPIs. So let's just move on. Okay, guys, if you have questions, we've got lots of time in the end.
Sure. And maybe Russ, maybe if you don't mind, I'll underline the idea that if you are not currently working with an NPI, but you would like to, which of course I would encourage, that you're in touch with Russ specifically, and you can have a discussion about who might be the best person to collaborate with.
Yeah, absolutely. And they're all at different stages of development, right? So some that have been around for many, many years have been working with schools and CLCs and doing all kinds of stuff. Others have, maybe very little experience. So by all means, reach out to myself or Amy. We can link you to the MPI working in your region. I just wanted to show you a little bit too, like, what do they do? Because I've spent a lot of time, we try and share the CLC frameworks to them so they understand, the way that you guys work. It's almost very, very similar, but there's 5 main strategies that an MPI will do. The first one is networking. So their role, it's kind of a daunting role in many ways. It's to go and to meet health and social service providers in the region. And we're talking like all the, we're talking community-based organizations, French community-based organizations that are offering services, not just say the CIS and CIS. So it's a pretty overwhelming to get yourself known and to represent the needs of the English-speaking community in the area of health and social services. Part of that too is to network with you guys and other English organizations. As you guys know, depending on the region you're in, sometimes there's maybe a handful of English entities like schools and school boards and maybe a couple of churches and organizations, but in some regions there's very little. So most of the networking is in the French sector. The representation, so you may actually, just show of hands, how many people are sitting on a board or a table in the community? Just to give a feel for it, yeah. Yeah, I have no doubt. I have no doubt some of you guys are, and good on you. So this is the same as the NPI. So this is where you might want to call them to see which tables that link to your school environments, whether it's school perseverance table, or maybe if you're involved in something around mental health, a mental health table. Your NPI could also be sitting on it. Maybe there's a need for both of you. Maybe you could say, well, you sit on it, I won't, but I'll fill you in on the information. So their role is to go out and but we're talking, they sit on tables, everything from seniors down to early childhood. So it's the full different ages and populations. But where it's linked to your, I would say there's a little bit less in the area of representation going on from, I would say, grades 1 to 12. This is, I think, a bit of an area where the CHN works a little bit less in. But nonetheless, there's still all kinds of partnerships. Knowledge, I'm going to show you this in just a minute, but we work with Stats Canada, and we put together sociodemographic profiles that show all kinds of information and evidence of English speakers in your region. So if you're wanting to write grant applications, or if you're wanting to speak to service providers, or even people, staff in your school, it can give you a good representation of how many English speakers and what are their profile of the families that you're serving, what are the profile of their, their education levels, employment, their socioeconomic status. So in terms of their, are they in low income situations? So I'll show you that in a minute. So they build that, the NPIs, in order to do good representation and networking. And then the partnerships you guys are all so familiar with, it's the CLC model in many ways. Their goal is to go out and create projects and partnerships. And they have some resources to do that with. So if you're interested in to create some partnership and you see a nice link, they should be primed and ready to go with you, So the other thing is outreach. So more and more of these community organizations are actually doing programming themselves. So I'll talk to you a little bit more. Amy's going to talk to you a little bit more about some of the programming. So I'll leave that, but outreach is becoming a really big part of these NPIs. And there's programs happening right from seniors wellness centers in your region to early childhood programs. And Amy will talk to you on some youth programming that she's launching with all the NPIs. Great, we'll move on quick. Okay, so here's the UDOA, just a quick snapshot, you guys. If any of you have not looked at stats before, I'm sure you can gain access from your school board or from your school principal. They should have stats for your region, no doubt. Depending on what you can get your hands on, easily accessed in our website. These are called, if you went into the search bar on the CHSSN and you clicked in regional mini portraits, these are probably the easiest and quickest things that you can reference. It gives you everything in a snapshot related to the general socioeconomic indicators that might be of interest. It's a starting point for you guys just to understand if you have to represent your region. It gives you a kind of a nice starting point. I won't get into how you read it. It's pretty self-explanatory, but in the middle, you're going to see the chart. So all the images on the outside of the chart are the exact same numbers. So it's not new information. It's just presented in a different way. So if you look at the chart here, just you can read them, but it gives you an idea of the total population of the English speakers in your region and the percent compared to the French speaking population. So it's nice comparisons, right? So we're able to compare to the French majority. So sometimes when you're working with a French speaking PSOC or community-based organization, it's nice to show them that, maybe they've never worked with an English-speaking clientele before, and, this kind of gives them some information. Yes, this was Census Canada 2016, so it's getting a bit old. We've all had the survey that was sent to us last year, so we should have new census data and stats like this ready in about 1 year. Unfortunately, it takes that long. I won't go through all this, but some of the ones that you're probably most interested in is children 0 to 14. Lone parent families indicator, that's a really important indicator for you guys in terms of looking at vulnerabilities in your regions. Other things is like, you can read them, but living below LICO, so that's the low income cutoff line. I'm sure some of you are also NAN schools, but this, if you're not, you could be on the borderline, but you could have a higher percentage of families that are living in low income situations. That's a very important indicator for you guys to know in terms of vulnerability. Also education rates, employment rates, and things like that. So,
Russ, can I chime in for a second?
yeah.
So, I was just reviewing the chat again about what people wrote about what they want to get out of this, and a lot of them is ideas as well. And I wanted to just kind of highlight that ideas are essential and important, but there's something around identifying the needs or using pieces of data like this or some of the other tools that we showed you to really get a sense of what the needs are, so that any strategies or ideas that you put in place respond to something that's happening in your community, which is really important. So, for example, looking at unemployment and seeing that there's a higher rate of unemployment in English-speaking communities is a great place to kind of start from, saying, okay, well, what does that mean, using a few other tools. So I just want to highlight again how important it is to be rooted in some data, especially in conversations with partners who also are working on these types of factors as well.
One person asked too, just around racial and ethnic data. Absolutely. There's also StatsCan has other data sources that you might want to cite. In some of the stuff we've done, you'll see recent immigrants. And also we do have a report on visible minorities on our website that also has some of that information. But absolutely, there's all kinds of information that's not here that might be very interesting for you to collect. And
this is an example of connecting with a local NPI who would have this information as well, working in similar regions.
Yeah, most all your NPIs they get all this stuff, information. We help them, and they'll make infographics already, and they should be promoting it in their region. They get resources to do needs assessments and different things too. So connecting to them to see what have they collected already and what type of information they have is a good starting point. There's other groups in your communities that might collect it with the school boards, but the Literacy Quebec chapters too, I just worked with them. Some of them are collecting data more and more based on their mandates, literacy and stuff like that. So yeah. There's people that raise their hands and stuff. Ben, I don't know if you want to.
Oh, okay. I didn't see. So let me, I'll let you turn on your mic if you have a question.
Yeah, I just wanted to say, Russ, I just Googled the regional mini portraits, CHSSN, and then I punched in Montérégie, and I was really impressed with the charts that I pulled up. A variety of charts for the proportion of vulnerable children, gender-based profiles for men. I mean, it's just an amazing amount of data. So thanks to you and your team, I wasn't aware of all that stuff. So just trying that out today, typing in the area, very impressive.
Yeah, that's a good point, Brian. And thanks for that. You guys, if you want to go on the search bar, you just type in your region's name, and that'll pop up all the data that we have, all the documents for your region. Exactly. So there'll be 0 to 5 profiles. We have youth profiles, 15 to 29, seniors. We have stuff based on men, women. We'll have stuff based on visible minority. We need to do more work, but yeah. So the CHN, it is one data source you should consider among others. That's, yeah. So. Great. Okay. I think we're turning it over to Amy.
Yeah. So within the CHSSN, my role is to oversee the Youth Mental Health Initiative being implemented among 28 organizations, some of them NPI, but not all. So there are about 7 that are just organizations, mostly within the Greater Montreal area. But the rest are across the region, as we described in that beautiful map. We have a bunch of them spread out. So our shared goal as a group is to improve young people's access to mental health services that are adapted to their needs, and also increase youth's involvement and reduce stigma surrounding mental health challenges experienced by said youth. So that sounds pretty big, and it is, which is why we need all the partners we can get. working together with these organizations to reach that goal. So I know that many of you are working with the age ranges perhaps before and after 15 to 29, but this is where we're trying to hold on to those most vulnerable youth who need access to mental health services. So they'll range within high school, end of high school, to adult education centers, CEGEPs, trade schools, universities, and in some cases, none of the above for the most vulnerable. So to call back to the data that Russ was showing us briefly there, what we find the most prevalent among the age group 15 to 29 is that there are higher levels of visible minorities, there's lower income, there's more lone parent households, there's more youth living out of home at young ages, unemployment is quite high, there's education level that is lower compared to actually English speakers from other age ranges. This is fairly new to me. I was surprised when I read that because we have the old stereotype that English speakers have pretty high levels of education, even though unemployment is lower. But we're finding that dropout rates are quite high in the English speaking youth of this age cohort now. So I thought that was interesting to highlight because that stood out to me when I was looking at the data. And should you go to our website, you'll find that there. Of course, by the regions, it might vary, but this was the cumulative results of most of those mini portraits and that information. So looking forward to more information coming out. But we do know that presently studies being done right now indicate that the pandemic has worsened the situation for ages, I think it's 14 to 29, this last study I saw done. Anyway, if I quote anything, feel free to contact me and ask me for that actual source and I'll get it for you. But the pandemic had a real impact, of course, on the schools, but notably on young men within the ages of 14 to 29. So I thought this was interesting too to bring to the fore if this is an area that you're trying to develop or look into. So our NPIs and organizations are working towards this initiative. And as I move forward, maybe I can elaborate on how that connection is going to help both partnerships to the same results: increase wellness, well-being, and increase prevention. Which takes me to the next slide. Thank you, Ben. Right on target. So here we're looking at what most of our NPIs are doing in their approach. So they will be overlapping with you and coming to get you for several of these things, no doubt. Is the mental health promotion. We're very familiar with that. I'm sure the schools are very deep in that too. Via mental health literacy. So we're trying to increase awareness and understanding about mental health, by consequence, reducing stigma, building capacities like skills that will help in coping mechanisms to build resiliency, and empowering youth, of course. So all of these things are being used to try to increase general well-being within schools and communities, but also mental health, mental illness prevention. This is an area that we all hope to develop too. A lot of us aren't that comfortable in that area because we think that's an intervention area, but schools are sources of intervention, whether they want to be or whether they're equipped to be or not, because we know that links between teachers and students, between staff and students, between parents on committees and the children or young people under their charge is immense. So everybody's finding themselves somewhere in this approach. The question is, how are we going to be strategic about implementing it so that support networks are strong for youth, whether it's in the school, at home, or back in the community? So I would say that working with the NPIs, the earlier you're on the same page with them, perhaps the more strategic you can be in aligning the use of these resources. For instance, and we have a great example here presently today, but I'm sure we can talk later about that. Whereas CDA wants, let's say, a parent-teen workshop and finds the professional who can offer this kind of workshop. And that's where an NPI might want to really be involved because they can wrap this into their overall project of youth mental health and provide maybe resources, research, and or evaluate the project at the end. And you can see the kind of impact that you're looking at far beyond the school. So that's the approach that we're really digging into with our NPIs. You're welcome to read more on that and look at the slide after the presentation. And if you have any questions, I'm more than available.
If I could, I just want to add one thing too, just based on the approach Amy presented. I think one of the things we're really trying to do, I think the emphasis on all the work that we do with the CHN is trying to connect communities and schools to professionals. So people who have the skills and expertise that are paid for their livelihood to do this type of work. So obviously mental health professionals is really key in this approach. And when we're saying mental health professionals, we realize sometimes it's really hard to connect to people who speak English as their mother tongue that can offer services. So it's why when Amy's talking about, you know, mental health literacy and promotion, there's all kinds of people that can speak on these topics, that have qualifications. But it's really to find people who and build a network of professionals that are qualified to speak in this area. So I think making links, that's a really important aspect, I think, of all the work we do, but in particular this approach, because mental health can be, everyone seems to be an expert these days. So we're really trying to, not a bad thing, but it's really trying to connect to professionals, yeah. Which is, I think, why Jerry's here too. And Ben, I know you connect really well to the Center for Excellent Mental Health, and we're connecting to the, Mental Health Association, the Montreal filiale with Geneviève Fecteau, and there's other groups, but it's really making sure we're anchored in evidence and solid practice in what we're doing.
Yeah, thank you, Wes. And in fact, Jerry raised his hand right on cue. I wanted to also add one or two more things to what you said, which is, NPI, the CHSSN is a great partner. I always want to encourage CDAs to make sure they're connecting with their school board, complementary services, professionals, and people that are doing a lot of work around this as well. And I want to maybe invite Jerry to chime in as well. What's important about Jerry and his work with the CEMH, the Center of Excellence for Mental Health, is that they're also connected to great professionals and resources. So Jerry, maybe this is a good time just to chime in.
You know, I listened to Amy and what she's saying here, and it really highlights a couple of things to me. These are excellent initiatives, and excellent topics, prevention, promotion, literacy. But it's to Russell's point about really knowing what, defining your terms. It sounds good, prevention, but what is prevention and how do we do prevention? What does that mean? Talk about protective factors, risk factors, etc. It's all great words that seem to say an awful lot, but when it boils down to it, we really need to be very precise about what are we talking about here. When it comes to prevent, how do schools do prevention? When we talk about prevention, for instance, the public health has a different kind of definition about what is prevention than what we do in schools. So really looking at a school-based kind of or a community-based idea about how do we actually prevent mental illness? And there is a body of literature out there that really does talk about the school's role in preventing mental illness. So if you think about it in terms of how social determinants, how there are things out there such as poverty, such as discrimination, such as marginalization, such as learning difficulties. These are all factors that can have a negative impact, you could understand, on children's mental health. So schools, by countering those things, by making children feel included, by recognizing when they're being bullied or when they're being excluded, that's how we prevent those kinds of things from happening. So although we can term it, use rubrics like risk factors, I think we really need to be very explicit about what we're talking about. Similarly, in terms of promotion and health literacy. Mental health literacy is not so much, there is a stigma attached to it, but if you think about it, is that young people, adults to a certain extent, don't know what is the difference between feeling sad, grieving, and being depressed. So literacy is about understanding these things, taking the mystery away from it. And there's, on the one hand, a body, there are experts around who can talk to those or discuss it with you. But these days with young people, and it's a youth approach, we've got to look at what is online, what is available to us through the internet community. And we've just completed, because that too is variable, and we just are working on a document at McGill University to help professionals identify what are those really good resources that are out there that instead of just giving a link to a website and say, oh, they're talking about eating disorders here, that there's a way to vet it in a way that is really helpful. So these are, I don't know if it's, I think it's my caution to people, because when we talk about mental health, often we say, oh yeah, I know what mental health is. And as we can see, it becomes a lot more complicated than that. And we have to, that's, I think, why I love these opportunities to share with people and to talk to people, so that we can really get our heads around what's being, what's constructive and what's helpful and what's on target, that really talks to doing these prevention, promotion, and literacy.
Great. Thank you, Jerry.
So in our process of implementing youth themselves in the, I wouldn't say rollout of services, but in the conception of what they need to access health and social services. Are any of you familiar with the Roger Hart's ladder of young people's participation? I'm curious to know if this visual says anything to anyone. It's called a ladder, and yet it's a set of stairs. So if that speaks to you, tell me if you've seen the ladder before and or the stairs. I'm not seeing any hands. Maybe I'm a little,
No, this is
Okay.
new.
This is new, great, right. So basically, the theory here is the higher up the ladder we go, the more we're essentially working alongside youth in addressing what accessibility to mental health and wellness looks like for them. Of course, that's me applying the ladder to our project in mental health. So in adopting this process, we'll not only answer the question of what is accessibility for youth, but will also help us to create organic and sustainable change, where youth will be affecting the changes and understanding the enjeu, as we say in French, that will impact their own well-being and that of their peers. So you can see that in every rung of the ladder, stair ladder, youth are being implicated at different levels. So at the very top and the one that we're aiming for the most is where young people and adults are sharing decision making. So as I mentioned, they're invested in what's going to come out of it, and they're affecting the change for themselves and for their peers. So that is like the top of the top. Hopefully we get there, everyone in their process of implementing the projects in their communities, within their schools, and within schools and communities, I should say. One good example of that, if I can throw it out there, that Russ brought up to me not long ago, was the Sentinels program. It wasn't conceived by young persons, but it was implemented and involves young people, teachers and students being sentinels. So persons that you can contact if you're struggling with mental health, and they point at I should say, for students within the hallways. So that kind of impact and connection is a good example of decision making where they were undergone training, but also are entrusted to be carers for each other and their peers. Annie, is that a hand up?
It is. I just wanted to let you know that there's another program coming out called Les Éclaireurs. And that's basically, I would say, Sentinel 2.0, where community anybody in the community can be trained to become an éclaireur. And I'm part of an organization who's going to be offering the training. So hopefully in my schools where there are sentinels, I was the sentinel trainer. We are also looking at having people in the community that could be even parents trained to be éclaireurs. So that's coming in January 2022. So if anybody in your region, look for the money came down to the CIS, and they are the ones who are, so if you've heard about Les Éclaireurs, I know there's some in the Laurentians. There should be a project coming out of every CIS in your region. So just a little heads up.
So that's a great opportunity then for me to say, reach out to your NPI, because your NPI is the connection to your CIS, and they will no doubt be aware of this wonderful initiative. Thank you, Andy, for sharing. That's
welcome.
Great. A wonderful example. Moving on to what you say about what they want to do. So this is part of a compilation of research reports that Russ put together, many different sources, I'm sure, where youth were consulted, and this is what they said they wanted from those that are creating programming, from those that are looking to understand what their needs are. And it's quite simple. Like anyone else, they want to be involved. They want to be allowed to talk, to have a voice. So to have not just being stakeholders of the end result, they definitely want to be involved in the process, like we saw on that ladder at the very top if possible. They want to be given information and therefore be able to make informed choices and pick things that are relevant to their lives and the delivery of services. They want to be able to respond better to peers in their age group because they tend to help each other out. I mean, it's common knowledge that they will first look within their closest circle. So how can we better equip them for that? Learn how to cope better through difficult situations. You can only imagine that through COVID, they're looking for all sorts of coping mechanisms that we haven't even had the time to study and provide. So, I mean, this is cutting edge stuff here where they need our assistance in those areas. Help create social and positive activities. So they want to be involved in physically doing activities and implementing them. They want to educate others on reducing stigma. So a wonderful health literacy example right there. I'm reading off the chart here, but help us better understand the resources that are available to them. So helping, it's a bit of wayfinding there. We're helping them know what's available to them in their region, in their school, in their area, as far out from that network of support that we can go. So clearly the community development agents, yourselves and your staff and workers in the school are in close proximity to youth, and you're boosting peer-led activities, no doubt. You're fostering that essential grassroots trust building between youth and between yourselves. So you're really like the first network of support for most youth in the age ranges I was talking about. And so your framework involves like the spiritual animators, the guidance counselors, school nurses, social workers. And this is precisely where NPIs kind of need you to help them identify and signal the needs of youth because you're so close to them. So there's a great mutual benefit that you can be had by partnering with your NPI, because they need to know on the ground what's happening. You want to give them, you want to flag the issues that are happening, and then together you can work out solutions and funds and resources and strategy around frameworking youth and their support systems. So these are the things that I'm trying to encourage our NPRs to be in touch with you guys and vice versa, so that you can build better and more sustainable supports for youth that will continue on after school and or into adult education and afterwards, because we know that when youth are better supported when they're young and in those challenging developmental times, that they will fare better later on. And so the trust that you're building now with your youth is going to have huge ripples in their development and well-being down the road. There you go.
Thanks, Amy. So I want to just sum up. And again, I feel like I need to just like keep hammering this over the head a few different times that, you know, as community development agents working in CLC schools, there often is an emphasis on the activity. But really, you know, activities are important, but I think reflecting on what Amy and Russ and Jerry are speaking about is the importance of the community development agent to be able to take 1 or 2 steps back, look at who all the different partners are surrounding, so that when an activity does develop, it is not the CDA that is like holding all of the knowledge and all of the kind of different moving parts. Like, who are the other people in the region, in the community, that could help make this happen? Because there's a few tips around developing strong partnerships. So one is identification of needs. So you'll notice, again, those resources I shared at the beginning. I'm about to share a link with you where you can find those on our website, but also in a pad that I've created. What are the needs? What are the assets? What is the data available to help make sure that that's not an activity for an activity's sake, but it's like an arrow hitting the target of what is necessary. Another thing I want to emphasize is this idea of common outcomes. The CEMH, the CHSSN, the CIS, like all these different English and French organizations, they often have common outcomes. They want to work together to support the health and well-being of youth, of families, of teachers. What are the things you can work on together to hit those common outcomes? And this is through strategies, through activities, and through writing grants together as well. If money is needed, to help do something amazing, write a grant together. There might be different angles, but if you can get the money to support students and at the end of the strategy, youth anxiety has gone down, for example, like boom, some other organization is going to love to hear that and be very happy to share those resources with you. And the third one I'll just say is ongoing communication. So sharing the planning process and the indicators of success. So CLCs, you're developing these action plans, you're developing these school success plans. Like, it's okay to be like, this is our ultimate goal. These are the different outcomes we're looking for. These are the ways we're going to achieve it. Like, if you have ongoing and open communication with different partners that you work well with, then you're probably going to find that there's ways you can work together that are not apparent by just having a meeting together. Open up the books. So Annie, I see you have your hand up, and then I'm going to actually just switch to the next slide. And then actually, Annie, before you go, because I'm just going to show this, because then I'm going to turn off the PowerPoint so we can all see each other better. So the next section is like where I actually want us to have a conversation about what it means to have good school health partnerships. So I'm interested in tips, experiences in your CLC around what has enabled success. And I also want to invite people to talk about or describe some ongoing challenges and potential solutions that they've experienced as well. And before I turn this off, I want to also just highlight to Annie and to many of our classic community development agents is we have this whole new cohort of new CDAs, which is really, really exciting. So I guess I want to invite very much the new CDAs to ask questions, bounce ideas, but also invite our classic CDAs to share what's worked for them and any tips they might have. So with that, Annie, you want to share something?
Yeah, I just wanted to know if anybody else as a CDA has been asked. I was contacted by the Santé Publique because they have a new program called the Prévention, Promotion, Santé Mentale. So they've have new teams that are being deployed in all regions. And actually, I was lucky enough that for Riverside School Board, they contacted me because they'd seen my name or they'd seen me on different table de concertation. And I basically hooked them up with my adult education centers and my high schools because they're working at each school has a representative from the Santé Publique that will be working with them. So they're trying to get, so as the École en Santé was part of the school, now they have a new team. So it's, they call it PPSM, so Prévention, Promotion, Santé Mentale. So I'm not sure if any of you have been contacted or if they've contacted your school board, but they're looking to have partnerships, and actually they have women resources, actual people who are willing to come in and work in your schools and help you develop and research what you're doing right and what they can bring in. And they also have that with, I believe, drug awareness also. So not only mental health, but drug awareness. So we've just started. I've met with them. They've met with my principals, and we're looking to see how they can come and visit the schools and how they can get involved in our different committees, whether it's mental health committees that are already running in schools. And they're offering all of their expertise. And obviously they cover many schools. And my region, I mean, one of them has 8 schools, so I can understand what she is going to have to go through. But they are willing, thank God, in my region to translate all of the stuff that they have. So reach out to your, I don't know who at your school board can help you figure out if they have contacted the Santé Publique, but it's out there. So that's it.
Thanks, Annie, for the hot tip, as they say. Well together, and I guess I wanted to invite Karen and Annie. And just to share, I would say like high level tips on what creates a great partnership and even flowing down to specific activities and how we got there.
Well, first it starts with the commission that Annie makes every time she plugs me somewhere. No,
There's
it's a
no
great,
money exchanged.
no, it's a really great collaboration. So I'm an external person, 15 years at Youth Protection. And a few years back, I started to connect with Annie because she was on a tab with me. And I said, what can we do to be a bit more prevention based? Because Youth Protection, as you guys know, it's kind of at the end of the road when the S's hit the fan, plus. So we started working together years ago, and it's just continued, growing and expanding, is supporting parents with preteens and teens going through those difficult changes, if you will. So what enables success? I'm going to start out. There you go, Annie. There's your commission. Annie's amazing to be open and receptive and available to the ideas that I brought to her. Like, I had no idea what I was coming at her with, and I was just like, hi, you speak English? And that's how we started. And then we just kept talking, and she was very open and made sure to make the time to kind of help solidify ideas or clarify, and not hesitating to bring in partners or other people who could perhaps bounce ideas or offer resources. So just, I think the attitude has everything to do with it. So it's because of that I slowly gained the confidence that I could start maybe contributing something to this partnership, and then kept growing. So that's enabled success. I don't know if that was specific enough. You said high prime, but I think that's a big one for me. Just being open and receptive, encouraging.
Great.
And through our partnership, we were able to solidify links with ARC, which is our local NPI. And then they were able to find the funds to pay Karen so she could come offer services in my school. So that's been ongoing for a couple of years now. We've moved on to not only offering parent workshops, but now Karen is actually doing a mental health focus groups with the high school students. So it's been wonderful because now I've sort of hooked her up. They actually, she walks up to the front office and they let her in because they know it's Karen coming.
They give me the keys.
She's sort of part of our high school right now, which is amazing because our aim is to help the adults in the building. So we're started with the kids, but our aim is to help the teachers, the staff better understand what the students are going through, what they're going through, and just to build a better, healthy school community. So we have long-term goals. So our collaboration is not over. We're just starting out, scratching the surface and figuring out how the school can sort of, with different things we do the school, our school surveys, we do all kinds of things. So everything is sort of finally coming together. It's making sense, and we have buy-in. So that's fantastic. The school is really happy to see that we can, collaborate with people outside of the school and how much good that it brings. Because sometimes, they're used to dealing with, the school psychologist, but they don't necessarily go outside of the school board. But this is showing you how you can bring someone in and just reap the benefits.
But I'll just intervene on that last note. Is the barriers and roadblocks, Ben, you were asking for, is the buy-in that Annie's speaking of. I wouldn't say it's sold yet. There's a lot of the kids, and I think it's amazing, but the staff and the teachers and the parents, they can all have a more involved and educated and impactful role. And we're still not there. I think it's two categories. And so we talked, I met with the staff, the direction last week, and it's just about how to bridge that gap, because adults are affected as well. And if we continue to be no, we are not, well, guess what? Nothing's going to really work. So I think that's a roadblock, is to open it up with the adults and make it safe for adults to be hey, I'm struggling too. And that's okay. Anyway, thank you.
Thank you. And I'll just note on that, collaborations take time. So that's something to be patient and to build as well.
Yeah, you mentioned at the beginning, Ben, about school success, and I in the talks I have, I try to be very clear about the important role that schools play in the mental health of students, but that it's different than a clinical role, that we do have, for better or for worse, there are CLSCs, CUSs, there's community resources that are supposed to be there, often because, and especially for the English population, there's a penury, there's a dearth of resources, that because educators and people working in the community have such huge hearts and shoulders, they take on stuff. Taking on stuff that's really somebody else's domain, in a way becomes expedient for agencies to say, well, they're doing that in school. They're doing that in school. And I think that we have to recognize that when we talk about school mental health, it is something very particular. It is something very important, but it's different. You know, we excuse me, we need to be there to evaluate kids who are, or like your Sentinel program or your any of the programs about awareness and literacy. We need to know what are the warning signs, and we need to be able to do a suicide risk assessment in a school, the psychologist. But at the same time, we need to be able to have social services, appropriate social services in the community to pick up their role. So that talks about a lot of coordination and a lot of collaboration. So when Ben, as I started saying, talked about school success, we're there to promote the school success within our mandate. And one of our mandates in education is to socialize, to help young people, and I think these days too, adults too, comment être, how to be good human beings. And that requires a lot, again, of collaboration. I think the things that I've seen go really, really well, whether it's with NPIs, CHSSN, CDAs, CLCs, is when we tune into what's going on in the school. That it's the teachers and les responsables dans les écoles, the directors of the school. When we're collaborating, like nothing holds us back. But if we go off on saying, oh, well, I think this is a great idea, and we're going to bring, what's his name, Chris Nyland to come to the school to do a rah, rah, rah for us. Well, I love Chris Nyland and he's a great person, but is that really in tune with what the school needs and what the school wants and where the school is at? So I think that, like, you know, what Ben's saying, it's a slow process, but we build our connections with each other, and maybe it's a few little baby steps that we take in that everybody's involved in it. And sometimes, you know, you make a committee that's too big and it's ineffective, but sometimes it's like what people need is somebody who's going to work at it, you know, nose to the grindstone kind of thing, and make things happen. So like the best thing, like it makes me think of Riverview when we had those lunch and learns, or we had the supper and learns, and we provided daycare, we brought in people to talk to parents, or the things that we do with with Learn. Those, how many people registered at the last parent webinar, Ben?
Oh, you know, 140 or so.
And we've had more than that, you know, and they're recorded, and it's like, I think those kinds of things have impact, but it's about collaboration, and that's the big thing for me. And I say that because I really do think that it's not as it's easier said than done.
If I can just add, Ben, I think one of the things at Riverside that really helped this year is they've made the CDAs part of complementary services. So now we are part of the integral sort of with all the other professionals. So when we talk about what's happening in the school, we're included in these conversations. So by being part of that, it makes us sort of think about, well, what can I bring to the school to help? What are the community resources out there? So it's basically every professional has access to the community, which before they didn't necessarily know what was out there. Like I knew, but we weren't collaborating. So now we've got this wheel starting to turn, and with me being more aware, and even the schools, because I do cover a lot of schools. So the schools that I'm not always in, at least when I go to these, we have these MDT meetings where all the professionals are there, then I can sort of understand what's going on. What are they? Okay, this is happening in the school. There's things, and what can I be as a CDA? What can I bring in? So I think that's very valuable, and happy that the school board sort of clued in on that, on how we can be part of the solution.
Absolutely. And before I pass it over to Ruby, who I saw had her hand up, some very direct feedback we received from the ACES committee, which is the kind of complementary services of all the school boards, is to ensure that CLCs are working in alignment with school board directions. And so it's important to have those conversations and really complement what is already being done. As Jerry said, like, if we're all moving in the same direction, really so many wonderful things can happen. Ruby, great to see you again. I saw you had your hand up.
Yeah, it's nice to be back, actually. Thank you. When I came back, what I was shocked by is how staff was tired. I thought I was going to be tired coming back, full time, but that was my surprise coming back. And I just want to bring it, and we've been talking about what we can do for students, but please, let's also not forget the staff, because even the best teachers, we all have those special teachers. We have something, we have an idea, we run to them, we know they're going to buy in. Even those like superstars we have are not even superstars. And they say it themselves. And in my 3 schools, my 2 elementary and my high school, I've heard the same message over and over again. I'm just waiting to get to Friday. I'm just waiting for the weekend to come. They're tired. So what we've done in my 3 schools is we've had staff yoga after school. Once a week, we had 6-week session. And we had about 10 teachers from each school actually come in and take that time for themselves and relax and just do nothing, which has been nice. So let's not forget our teachers in all of them.
So Ruby, to ask the follow-up question, can you just quickly describe, like, who was the person who led the yoga session? Was there a grant that helped pay for that? Was there a school budget? Can you just talk a little bit about how you made it happen or how it happened?
We do have an ex-teacher who used to do substitute teaching for us, who is a yoga instructor, and we've had a relationship with her for like maybe 4 or 5 years now. And she's come into the schools and done yoga workshops with students. So this was something that just seemed to happen naturally. It was the need of the teachers being so tired and knowing who this partner who's been around forever, just putting them together. And that's what it is. I think CDAs, we're professional knitters. We meet people who have wants, we meet people who have needs, and over the months, the weeks, the days, the years, you get them all together, and everyone can make those partnerships, whether they're big or small. Over time, it grows.
Thank you, Ruby. I love that metaphor analogy.
The knitting analogy, that's, yes, I think I'm going to get myself some needles there, start knitting some more.
Right, you can also poke people when necessary.
No,
Russ, I saw your hands go up a little bit. Go ahead, Russ.
Oh, I just wanted to, I'm off mute, yeah. I just wanted to mention, just reinforce you guys, just like over the years, just seeing some of the CLC initiatives that have really bloomed. And it is that there has been good collaborations with NPIs, but I really just want to reinforce what Ben and I think Jerry were saying too. It's really around, I found, connecting with the complementary services person at the school board. I can't reemphasize the amazing things that have happened when that connection has been made, and like resources, additional resources can come. I've seen happen. I've seen where they'll bring in, like, Learn is obviously a great internal resource for you, but Jerry represents a center for excellence, and the comp services person I've seen bring in, professional. There's other excellent center of excellences within your school boards. Like there's the Center of Excellence for Behavior Management. Jerry's the Center of Excellence for Mental Health. I've even seen the Center of Excellence for Speech and Language Development come in. So there's other ones. If I just go quickly do a scan, Center for Excellence for Autism and Spectrum Disorder, Inclusive Schools Network. These are your professional resources that I've seen. If you can connect and be kind of aware of them and connect your comp services. In terms of buy-in, I've seen a couple times where I learned that, there was having trouble having buy-in, but when you can connect to your own internal resources that can help you, it also helps in buy-in, I think, too. So,
but other than that, I just want to thank you and just reiterate one more time that it's all about partnerships. That's what CLCs do, school community partnerships. Work them, have discussions with people, and together, I think, as Jerry alluded, together we can make so many wonderful things happen. So that's my pitch. With that,
Ben, can I just say another partnership? I know Michael's not here, but Michael and MEPEC have been working really hard together, and actually they're working on translating a document from our French school board that is on his territory. So himself, MEPEC, and the French school board, they're translating all of these material for the pre-K. So there's a lot of stuff that can be done for the pre-Ks also, because that's a hot topic right now too. And a lot of the organization in his territory, which is the Valley of the Richelieu Valley, doesn't have many English organizations. So basically there's a working partnership with the French school board, MEPEC, and Michael, our CDA in the Valley, to translate all of this great stuff that the parents of our English schools are going to be able to benefit from. So the material was already made by the French school board, and now it's just going to be translated and adapted. So, I mean, there's all kinds of stuff. I would strongly suggest to connect with your NPI. I mean, I'm lucky enough I get to work with 2 of them. So, and they're amazing. If you make partners with them, you can, it's endless what you can do.
And Annie, I mean, I feel so bad for talking so much, but the thing I want to underline as well is that as CDAs who work in schools, we have such valuable, we have the population that NPIs want to work with. It's how do we connect with youth? And you're I am surrounded by youth. If you can make those great partnerships and kind of open the doors for those resources, I think it's really valuable.
If I could, Ben,
sure, Jerry.
Just on that note, I think that it highlights to me that information also is part of that process of collaboration. That we're not always informed of what exactly is going on. There's a tremendous amount of initiatives around the pre-K programs and what the pre-K program is, and the great effort that some of the people like CHSSN has contributed to the translation of government documents, when I'm told that government documents have to be produced in the original language. But when there's an envelope attached to it, I think that's the term, Russ, right? An envelope that's attached to it, all of a sudden things become possible. You see Jen there, McNeil, and she's part of a, well, she can tell you herself, but around that PK program to work directly with the agent de transition to provide materials in their own, not just materials, but they capsule videos, instruction, working with community and so on. But we need to know this stuff, just like we need to know what exactly is going on with Santé Publique. So a lot of their money, they had $25 million across Quebec and most of that money is going into drug prevention in high schools. It's hot for high schools. And instead of it being the schools and professionals or even the CIUS, they wanted community organizations. So they have upstart community organizations coming into schools, not knowing head from heel, who have been given big responsibility for doing that. And the same thing around Santé Mentale. And it becomes, rather than becoming a resource, like it's so important that people are knowledgeable of their context. Like, Ruby was saying about teachers, if we're going to look after children's mental health, we have to look after school mental health. If teachers, administrators, parents, the community is burnt out, it's like, how is that going to ripple down to the kids, we'll ring a bell and have them meditate. Okay, that's just my get off the soapbox and let you continue.
If I
Yeah,
can extrapolate on what Jerry and a little bit of what Ben was saying, I definitely agree that the sustainability of what will be done will depend on how far past your school your impact can go, and vice versa, come back to your school. So information about what the youth need and information about what the community needs. So the parents of the youth that are there, the teachers that are working within that environment, the professionals that are around them, that whole framework needs to be a dialogue. So I think that the benefit of having an NPI with you in your corner is that together you're going to solidify that link so that the talking to the CEOs becomes simpler or more fluid, and back and forth, back to the youth and back, like, how is the community digesting this? What is it that we really need? Let's come back again. So hopefully that when you build plans together, that sustainability and the continuation of resources and services strengthens and is amplified, so that our hope is that these youths will go on to be productive and well-rounded beings. So we need the services not to just shave off and end after their time in the schools, but to continue on and support the parents too. So I'm rambling, but I was very enthused by what I heard from Jerry and Ben. So
Go ahead, Ralph.
Oh, I just wanted to add that a lot of you guys on the call today, thanks a lot for all your work you're doing too in the early childhood stuff. I forgot to mention, Anne Recheck, so Catherine Demas from Learn, I'm sure you guys all work with her too. Like Ben's taken on some of the, all the mental health stuff and things, but Catherine has done an amazing job. And the other manager on our team is Anne Recheck, who works with Catherine at the Learn, and I think you guys maybe have seen her and stuff. So anyways, I just want to recognize all the work that you guys are doing, not only in this stuff, but all the early childhood. It's quite amazing, to be honest.
Yeah, it's been a great partnership. Before I keep talking, does anyone else want to say something or share?
Can I just say, I want to answer to Jerry saying, when I had the talk with the Santé Publique, they did mention about giving money to community organizations. And I said, if you want to help my schools, you need to give your money to a community organizations that can offer those services in English, because you can't just come into my French class because you only speak French. You need to come talk to my students about drugs in their language, which is English. So they're working on making sure that whoever we work with will be offering those services in English. And I think we need to have our voices heard. And these are situations where you're talking mental health, you're talking drug addiction, you need to have someone talk to you in the language that is your own. So in my schools, that's English. So I made that very clear. And that's what we have to do, because we need to support also the English organizations that do work in our area.
I just want to mention too, I also see, like, just like in our NPI network, we always pick on those that have been around a long time and have experience. So I see people like Brian Petter and Sue Min, and it's like, there's people that you guys have in your networks that have been there for a while that have a lot of experience. So same message I would give to NPIs is reach out to these people that have been there and made mistakes and have had successes that can share some of their knowledge with you. So.
Well, I want to thank everybody for joining. But I do want to say that this is a conversation that we want to continue. CLC, all about school community partnerships. I'm going to say it 1,000 times. And I encourage you to kind of, reinforce the ones you have, discover new ones, and I guess say thank you to the great partnerships you have right now.